Welcome to the next edition of the Ask Me Anything with Dr. Twyman. I'm a board-certified cardiologist located in St. Louis, Missouri, the founder of Apollo Cardiology, and I focus on the early detection and treatment of subclinical atherosclerosis. So I basically help people not have heart attacks. So this weekend I was off the grid. I was out in an area about an hour south of St. Louis and basically reconnected with nature. So minimal internet use over the weekend. So that's always my stories. If you're interested in that, that was the getaway house cabins. They're in a few different cities. Pretty cool concept. You book them for like 2 nights, and everything's included. In the space. You have a little kitchenette, a little bathroom, air conditioned. So everything you need for a weekend in the woods. And it was nice just to be unplugged from all the technology for a little bit. So I'll put a link in my stories after we're done chatting. If you're interested, they do give like $25 off for people who want to try it and see what it's all about. Definitely recommend it. Definitely will be going back. So lots of good questions tonight. So we'll get started here. The question is, structured water nonsense or legit? No, it's legit. Structured water or easy water is the other term for it. It's what covers all the biological surfaces in you. Your glycocalyx is structured water, so without the water being structured, it collapses and things are more sticky. So if you want a good intro to the topic, Dr. Gerald Pollack wrote a book called The Fourth Phase of Water. And if you want to go deeper in it, colleague Carrie Bennett, she's on Instagram as Carrie B Wellness. She's a wealth of information about structured water. What diet do I recommend for chronic angina, post-stent placements, persons, family members in the ER now? So the Mediterranean diet has the most data for patients with cardiovascular disease, but diet is more specific to your maternal haplotype, where you live in the world, seasonal. You need to get your protein to maintain your muscle mass, carbohydrates based off your glucose tolerance and your exercise capacity, and your fats based off your apoestas. So there is no perfect diet for people. It's very individualized. Another nutrition question, what's the best diet for somebody with high LPLA? Vegan, Ornish, Mediterranean. Again, diet has very little impact on LPLA. If you have a lot of inflammation, it will drive LPA up. So whatever diet works for your other conditions, I would be focusing on it. Now, sometimes in a low-fat diet, sometimes LPA will drop a little bit, but you're needing a drop of 90% or greater to have a clinical benefit. So I'd focus on making sure you have healthy nitric oxide levels and low oxidative stress and inflammation, more than concerning about what diet you're actually doing for LPLA. Another LPA question, what is the highest LPA I've ever seen? It's over 600. It depends if you're looking at the nanomoles per deciliter or milligrams per deciliter measurement. One of them will be abnormal if it's over 30. One of them will be abnormal if it's over 75, but 600 is very high. So they had 2 abnormal copies. I got a copy from each parent. When the LPA levels are that high, they already increase risk of vascular disease. Person did not have severe coronary disease, but they did develop severe aortic stenosis and ultimately required a valve replacement. So that's the major risk for those high levels of LPA. Are statins necessary? Not absolutely, but you need to lower the ApoB through any means possible. Person's question, atherosclerosis, can this be reversed in a 79-year-old? I probably would rephrase it as, can it be managed and go on to the point where you don't have a cardiovascular event? And the answer is yes for that. Can be full reversal where you have no plaque in the arteries? That would be very unlikely. If you live long enough, you pretty much always are going to develop some degree of atherosclerosis in your arteries. There was autopsies in soldiers who were killed in Vietnam, in their teens and 20s, and they already had aortic plaques, and they also had coronary plaques. They did not die from coronary disease, and that's the goal, don't die from atherosclerosis. So can it be managed? Absolutely. So do what you need to do to support the glycocalyx and nitric oxide pathways, keep oxidative stress and inflammation low, and manage your lipoproteins. Generally shoot for an ApoB less than 70 if you have known atherosclerosis. Person's LPA is elevated at 154, but their LDL, I suspect C, is 100, triglyceride 65. Are statins the only answer to avoid heart disease? No, statins are tools. Do I use them? Yes. Do I use them at all? Absolutely not. It's much more about your ApoB total than it is your LDL cholesterol. It's about the health of the arteries. So do you already have plaque in the arteries? Then statins are probably a tool to be utilized, especially if you're a hyperproducer of sterols. So possible, but it isn't the only tool to lower the risk of heart disease. Can you avoid heart disease without taking meds if high LPLA? Possible, but again, test don't guess. Look at your arteries. Do you have endothelial dysfunction? Do you have carotid intimal medial thickness on a CIMT scan? Do you have soft plaque in your arteries? Do you have hard plaque in your arteries? It's very hard to manage it once you start developing more significant plaque in the arteries. So I don't say there's always meds are first line, but often they're going to be utilized if you're trying to really significantly reduce risk factors. But always test the arteries. I've already answered this in part, but atherosclerosis, how to prevent it? It's mostly trying to prevent having events. But before you're 65 years old, probably 80-90% of atherosclerosis can be prevented if you don't smoke, keep your blood pressure less than 120/80, don't become diabetic, keep your lipoproteins managed, and don't become obese. Likely, you'll be able to keep it under check. But there's up to 300 different risk factors that can damage the arteries. So even if you have perfect physique, perfect diet, you can still develop plaque in your arteries. So you have to go looking for the plaque itself with tests like a CIMT, a calcium score, or a Clearly scan. And how do you prevent it? Well, again, it's keep your nitric oxide pathways high. So you can do testing to look at salivary nitric oxide pathways. You can look at your blood pressure. You can look at pulse wave velocity. You can look at a test called an endopat that tells you how much nitric oxide your arteries release when there's under vascular stress. So that kind of tells you, are you, headed in the right direction or not? Question about supplements that might make, I don't know what CAVD is. Don't you mean calcified valvular disease, possibly? Or CVD, or calcium and vitamin D. And those two help prevent worsening. I'd have to know a little bit more about what CAVD means to you. But in general, if you're taking calcium as a supplement under the orders of a physician because you have osteopenia or osteoporosis, you definitely need to have optimal vitamin D levels. Generally, I shoot for levels of 50 and 60. And you need to be eating optimal vitamin K2, either through diet or supplementation, to keep the calcium in your bones and prevent it from building up as kidney stones or in your vascular system. Another question about, is naturally treatable, is aorta heart calcifications naturally treatable? It depends. It's not likely to get better, but you can stop doing the damage if you keep oxidative stress and inflammation low. And I keep saying that over and over again because those are two of the bigger drivers for endothelial dysfunction. And once you damage the endothelium, then you're on to the point where you're going to get vascular inflammation and then calcified plaque in the arteries or on the aortic valve. So naturally treatable, yes. You got to exercise, be outside in the sunlight to improve nitric oxide release. You have to sleep optimally for the body to repair itself. You got to manage your stress. So there are a lot of natural lifestyle interventions, but are the calcifications going to improve on its own without, vitamin K2? Probably not. Short answer, can lots of plaque in the arteries cause extreme fatigue? Yes, especially this is sometimes a presenting function or feature or symptom of a patient who's developing atypical angina. Sometimes these are the symptoms that women present with. They don't always have the classical shortness of breath or an elephant pressing on their chest. They're just extremely fatigued. So if you have fatigue and they haven't figured out what's contributed to it, you may want to do a workup for atherosclerosis. In that case, a calcium score test to see if there's heart plaque in the arteries. But when you're symptomatic, you should consider doing some type of exercise stress test. We would love to know, number one, test to show arteries health. Number two, how to read the results. So this will probably be a little more challenging to put in this type of format, which is kind of more rapid fire. But if you want a more detailed finding where I went through a lot of the different tests, I have a video on my YouTube channel, which is just youtube.com at Dr. Twyman, or you can go to drtwyman.tv. I did buy that domain that forwards to the YouTube channel. There's a video on there called No Time to Die. It's about a 30-minute video where I walk through all the different tests I use in my office to test patients' vascular health, tell them how healthy the endothelium is, how much soft plaque, how much hard plaque they have in their arteries. And then I recently did a video of how I interpreted my own lab work. It will be released on YouTube soon, so it's kind of a teaser. If you don't follow me on YouTube, that's where you're going to find that type of information. What is the significance of the MTHFR gene mutation to cardiovascular disease? So MTHFR stands for methyl tetrahydrofolate reductase. That's an enzyme that's important for detoxification pathways. There are a couple labs that I will look at. The main one will be homocysteine. Homocysteine is an amino acid. If that amino acid is above 8, it will often contribute to increasing a lab called ADMA, or asymmetric dimethylarginine. That compound, when it's high, competes against certain enzymes that affect nitric oxide availability. So homocysteine can make your arteries stiff. It can make your blood pressure elevated. It can cause your arteries to calcify. So that's how having an MTHFR mutation might cause cardiovascular disease. Also, it may have an effect on the oxidation of the LDL. So some patients require methylated B vitamin complexes, methyl tetrafolate, trimethylglycine. So whatever you need to do to keep your homocysteine under 8. Somebody's reporting that their friend has albinism and major issues, but unknown major issues. Is red light therapy possible for somebody with no melanin? Yes, but this is not direct medical advice. But red light therapy in general, approximately 2/3 of the light reflects off your skin. So the acronym is RATS. So light either reflects, it's absorbed, it's transmitted, or it's scattered. So you're wanting the light to be absorbed, and the main source of absorption of the red light is in the mitochondria, in the cytochromes. So now this person would, even if they don't have melanin in their skin, they're going to have mitochondria that can get activated by the red light. They maybe just don't need as much duration or intensity of the light. So it's the time and it's the intensity of light that gives you the dose. And I'm not going to answer this particular question because I can't answer questions on dose changes of medications. You have to speak to your physicians, if you're wanting to decrease dosages of any medications. But in general, there are lab tests that you can look at that tells you if you're a hyperproducer of sterols, if your hyperproduction markers are low, and if desmosterol is low, then maybe you would decrease the statin dose. Okay, so sorry to hear you had open heart surgery recently. You'll have to talk to your surgeon. When is it okay to use photobiomodulation? I can't answer personal one-on-one questions in this type of format unless you're my patient. Does taking Tums daily increase the calcification in the aortic valve? There would be a potential to. The question is, why do you need to take Tums daily? Acid reflux is not normal. So work with a functional doc to figure out why you're having so much acid reflux. Do you not have enough stomach acid? Do you not have the ability to break down certain proteins? So look at that before always rushing to the Tums or the acid blocking medications, because if you block acid in your stomach, you then affect the nitric oxide pathways, and the arteries get stiffer as well. So somebody's asking, is a 70% blockage of the LAD artery reason to get a cardiac catheterization with possible stents? I mean, it's possible. I, again, can't offer direct medical advice, so I can't tell you yes or no to do this type of procedure. But I did train as an invasive cardiologist. I've done hundreds, if not thousands, of heart caths in my life. And generally, if somebody has a severe stenosis in the coronary artery, it is reasonable to have an angiogram to figure out the degree of stenosis, and if the blockage is greater than 70% and the person is symptomatic, or they have ischemia on a stress test, then a stent is a reasonable option. But I always tell patients stents are tools. They will relieve the obstruction, but they don't fix why you got that blockage in the first place. And stents have to be managed. You have to be on aspirin. You often have to be on clopidogrel or another antiplatelet agent to prevent clots from forming inside the stent, which would cause an instant heart attack and often can be fatal if that happens. And then the other issue is that the stent does not reduce your risk of having a heart attack. It does not reduce your risk of dying. It just opens up that blockage. So some people, that will relieve their symptoms. They'll have less angina or exercise intolerance or shortness of breath. But again, it doesn't fix why you got that blockage. And unless you fix that, you end up in the cath lab again. That's one of the reasons I end up leaving the hospital system, is because often the same patients would come back 6, 12 months later. They were on statin therapy, they're on aspirin, they're on blood pressure medicines, but what they were missing is they weren't lowering their oxidative stress and inflammation, they weren't managing their stress, they weren't sleeping well, and they weren't doing anything to improve their nitric oxide availability. So, it's kind of an open-ended question. It kind of helped me go down a little bit of a rabbit hole, but it is reasonable, but you need to talk to your doctor who's recommending the heart catheterization. Can mild aortic valve calcifications be managed so that it doesn't progress? Yes, you got to keep inflammation down and keep blood pressure optimal, less than 120/80. And depends too if you have LPLA. LPLA tends to worsen aortic valve calcifications. See a couple familiar faces in here tonight. And somebody's asking, does my practice take health insurance? No, the practice is out of network for all insurance carriers. Apollo Cardiology was launched about 5 years ago as an alternative to the traditional medical system. I still, do all the Western medicine things that are needed for patients, but to be able to offer the best advice to patients, I could not be participated in health insurance. I couldn't allow people to tell me what to do that weren't the patients. So it's more of an educational consultation fee that patients pay us, and then we have unbiased, opinions on what we should recommend the patient. There's no drug company or supplement company or health insurance going to tell us how best to manage a patient. It's my experience of being a physician for over 20 years and my experience of seeing thousands of patients in my life. So short answer, no, is we don't participate in any health insurances. Somebody says, some research says metformin causes mitochondrial dysfunction. That is slightly debatable, but it tends to knock out the weaker mitochondria, so that is what you actually want. So if you're diabetic, that is the benefit of it. If you're somebody who's using it just for longevity promoting purposes and you're a high-level athlete, that's probably more of a downside. It's going to affect your lactate thresholds. So don't recommend metformin for all. If you're insulin resistant or diabetic, then it's more of a benefit. Do I believe it can cause endothelial damage in the vascular? No, they actually studied metformin as something that would help the endothelial glycocalyx. So it did help enlarge the thickness of the glycocalyx. So I don't think it causes damage. I think it actually improves it. Does microvascular disease lead to stroke or heart attack? Yes, it can. 99% of your blood vessels are microvasculars, have microvessels. So take one of your human hairs, and approximately 100 of those microvessels would fit inside of it. So same concept, you have glycocalyx disruption, endothelial dysfunction in the small vessels. you can have decreased oxygen nutrients to the tissues that are perfused from it. So stroke and heart attacks definitely can happen from microvascular disease. Do I prescribe daily baby aspirin? And those that are good candidates for it, yes. So if they've secondary prevention, slam dunk. You've had a heart attack, stroke, stents, bypass, aspirin for life unless you're allergic to it or have significant bleeding complications while on aspirin. The real kind of gray zone is the patients who are for, quote, primary prevention, meaning they've never had an event. But honestly, that would only apply to people who really are primordial prevention, meaning they don't have any plaque in their arteries. Because the majority of people who are primary prevention, if you did the actual testing that would look at the subclinical atherosclerosis, you would find it in a great percentage of people. And so they're really kind of more 1.5 percent, or instead of primary prevention, like 1.5 prevention. So often if you have a calcium score, especially over 100, or you have some mild thickening of your carotid arteries, then aspirin, can keep fibrinogen levels low, keep platelets from aggregating. So do I prescribe it? Yes. Is it prescribed for all? No. What test can you use to measure the elasticity of the arteries? At home, it's mostly your blood pressure. Your blood pressure should be less than 110/80. If you have access to it, pulse wave velocity testing. There's different vendors. The one we use in our office is Max Pulse. And then you can also do the endopad test, which will measure the peripheral arterial tone, which is a little bit different than elasticity, but gives you an idea of how much nitric oxide your arteries release when there's a vascular stressor. And if patients are interested in working with us, they go to my website. There's an application on the website, and if they apply, then they're set up with an intake with one of my team members, and they can describe all the logistics of how our practice works. Is nattokinase an effective cholesterol-lowering enzyme? No, not really. Nattokinase mostly breaks up fibrinogen. Useful if you have blood clots. I've not seen much data that it has significant effects on lowering lipoproteins. I know they may have some, but there's some newer data that you have to take a lot more than most people usually recommend, maybe 10,000 units or forming units a day, but that gets to be very cost prohibitive when you start using those high doses, but not enough reason to consider taking it for lipids. We need to know a lot more details on it, but what can you do to correct an arrhythmia naturally? Well, depends on what the arrhythmia is, but often oxidative stress, inflammation drive them. Low nitric oxide drives them. Too much alcohol, too much caffeine, lack of sleep, high stress, sleep apnea, lots of things that cause oxidative stress and inflammation. Let's figure out those and lower those root causes. And then you would perhaps need like an echocardiogram to know, like, structurally, is your heart actually normal? Do you have normal atrial sizes? Do you have normal valves? That would be kind of some starting points. Somebody's asking, do I do virtual appointments? Person's doing some testing with their regular doctor, and then they're going to do some of the tests that I previously recommended. That's great. We do work with patients who are out of town. My practice of cardiology is located in St. Louis, Missouri, and I looked up the data recently. 60% of our people live in St. Louis, and 40% of people travel in to come see us. So at this time, if patients want to work with us one-on-one, the first visit is always in St. Louis. We do the non-invasive testing that you haven't done previously, and get any updated genetic labs and cardiovascular testing, and then a physical exam, and go through your history and your lifestyle questionnaire, and then follow visits can be virtual or telemedicine. All right. I think I got through all the questions tonight, rapid fire style again. These are always being recorded. These will be in my story after we're done chatting. I will save the video, put it up on my YouTube channel, which again is just drtwyman.tv. I'll use AI and it'll do transcripts if you want to search ahead to figure out which question was answered. It'll be in that part. For those that joined after the start, let's talk about that. This past weekend did a kind of digital detox, was away in the woods for a couple days. Highly recommend if you get the chance to do that. There's a company called the Getaway House. I have no affiliation with them yet, but if you want to try them out, I'll put a link in the my stories after this. I believe you get like a $25 off your first visit with them if you go do that. I think I get like the same amount back if you do it. So there's my full disclosure. I don't, recommend things that I don't personally use or want to continue to use. But if you're interested in, getting away and doing digital detox, that would be a good thing to take a look at. So appreciate your guys' time and attention. I'll be back next Monday, 6 p.m. Central Time.